Pleasure to be here. What about me? I'm an engineer by trade, but before that, just a kid from India who thought he'd be a doctor, found my way to the US, found bits and bytes, fell in love, and now am building a healthcare technology company serving the 90 million on Medicaid. So Pair Team is on a mission to connect underserved communities to high quality care. And we do this because about 36 million Americans don't have access to preventative care services. They have uncontrolled diabetes, blood pressure. And this is because when you have your basic social needs unmet, when you have housing, food, transportation on your mind, health takes a backseat. You wait, conditions flare up, and then you end up in the hospital. And so our patients are bouncing between social support services and health and hospital and emergency care, like emergency departments. And so it's not only a problem for them, but this is actually a massive problem on the US government. So Medicaid is about 15% of total government spend, right? The only thing eclipsed by is military spend here. And so what we do to fix this problem is we provide hyper convenient access to care by going directly into the community. We bring telemedicine services directly where people already go, into shelters, into food pantries, and other social support organizations. And this was only possible about 2 years ago with regulatory changes. So just as an example, this is a woman, 31-year-old single mom. She almost lost her foot to diabetic amputation until we started working with her and giving her care. So we do well by doing good. We've raised $20 million from tier one investors. And most importantly, our revenue now outpaces the cash raised. We're on track to profitability, and we know this works. We are able to meaningfully keep folks out of the hospital with evidence-backed support at this point. We have distribution across California, where we're a market leader, and now we're expanding into New York, Ohio, Nevada, 5 other states. And as you can see, have partnered with organizations like the YMCA, Boys and Girls Club of America. These are the trusts of millions of Americans nationally. And how we do this is simply we ship a kit to our partners. It consists of a tablet, Bluetooth connected devices, and through our Pair Team clinicians, we're able to provide convenient access to care in very non-traditional settings, as you can see here. And for follow-up care, everyone has a phone. Even those experiencing homelessness have a phone. So we're able to do texts and phone calls with individuals, just like a doctor and their family with our team. Now, to provide this very simple patient experience, which is what we strive for, our operations are super complex. And this is why we built ARC. ARC is the healthcare platform for community-based care. It's the first of its kind, combining not just physical and mental health care, but also social health care like housing, food, and transportation. What it does is it basically takes that in giant, complex operational mess, and we package it up into simple actions. Actions so we can do step-by-step work with our patients to walk them through their care journey. And that makes all the difference on their own health. So what are we doing next? Well, we're going from our tool to actually pushing this out into our community organizations as an operating system to our partners. Think staffing, financing, inventory management, etc. But also, and I'm sure this excites a lot of folks, is because we're so operationally focused, we can actually leverage the AI advancements here in an application-centric way. We can take the manual operations and actually meaningfully drive automation across chunks of manual work that was never possible before. And this is how you drive change in the healthcare system. So I've been working on healthcare for over 10 years. We work with the former chief medical officer of Medicaid under Obama. He worked directly on Obamacare, Dr. Andrei Ostrovsky. We have a remote team of over 100, but it's really powered by a very small but mighty product team. And this is where we want to support. So they support, can't tell you what it means for an engineer to work with a clinician and actually solve healthcare together. So we're hiring across the board. We're looking for builders that are ambitious and mission-oriented. If any of these roles stand out to you, please let me know. And on a final note, just to give you a sense of impact and scale, for every one clinic in this country, there are about 30 nonprofits. If you team each one of those into an access point for care, you are legitimately 30xing access for Medicaid and underserved communities. If that excites you, I'd love to connect. Thank you.